Welcome back to SA Live. Well, March is Colon Cancer Awareness Month. It often doesn't show any symptoms. It is often deadly, but doctors say it's also often very treatable. And joining us now to tell us more is Dr. Rowland Reyna, founder of HealthTexas. Good afternoon.
Hey, Mike, how are you?
I'm doing very well, sir. Okay, so why is it so important to know about colon cancer, and what should we know about it?
You know, colon cancer affects many people. Farrah Fawcett, Jack Lemmon, Audrey Hepburn, Chad Boseman. He was a superhero in the movie Black Panther. He died at 37. They all died of colon cancer. Ronald Reagan had colon cancer. My dad had colon cancer. I had a screening colonoscopy at age 50, and they found a big polyp that was turning into colon cancer. This is very important. 1 in every 20 people, or 5% of the population in the United States, will develop colon cancer at some point in their lifetime. Over 1 million new cases globally of colon cancer, and about over 700,000 people die of colon cancer every year. So this is really something that's very important. The average age that people die is 69. But colon cancer is important because it's the number 2 cancer in the country for both men and women after lung cancer. So, and again, 5% of us will get it. But what's important about it is that colon cancer is largely preventable. 50% of colon cancer is related to bad lifestyle. And it's highly preventable by the proper screenings.
So that's the most important thing, is to get screened. Now, I know there's a lot of times they say, what, at age 50, start getting colonoscopies?
You know, that's a good question because there's some controversy about that now. The United States Preventative Task Force Services recommends at age 50, but we're starting to find colon cancer now at earlier ages. Chad Boseman was 37 when he died. You know, I have several patients who have it under the age of 40. So it's becoming a cancer that we're starting to see more frequently. So certainly at the age of 45 to 50, for sure, everybody should be screened. And the screening techniques are really very simple. You can have the fecal occult blood, where you just get little cards and you check for blood in the bowel movement, or you could have a colonoscopy every 5 to 10 years, depending on the results. So anybody who after the age of 45 has blood in their stool, or a change in bowel habits, or abdominal pain, or a smalling, the stool getting more narrow, those are people who should be screened. They should actually be seen, but everybody should be screened because, again, this is a disease that's entirely preventable with proper screening.
Aside from screenings, other ways to prevent it would be, I've always heard, through diet. That's one of the big things, right?
Absolutely. So after screening, the most important thing, we need to eat more fruits and vegetables. The processed foods, the weenies, the lunch meats, the red meats, the processed foods, those are all really, really bad for us. So diet's very important. Regular exercise is important. People who exercise, and I've said this before, exercise lowers markers of inflammation, and inflammation causes cancer. So everybody should be exercising on a regular basis. People who are overweight have a higher risk of colon cancer. So get down to an ideal weight. That's very important. Interestingly enough, smoking increases the risk of colon cancer as well. And alcohol, if you're drinking 3 drinks as a man of alcohol, over 1 drink a day for women, that significantly increases the risk of colon cancer. So really, to a large extent, it's our bad habits and our lack of screening that's causing the increased risk of colon cancer in this country. And it's super sad because it's something entirely preventable. 50% of it's related to diet and lifestyle. And if we get screened, we can prevent this. I had a big polyp when I was 50 that would have turned into a colon cancer. They had to remove it in pieces. And because I had a colonoscopy at age 50, I am now colon cancer free.
HealthTexas Primary Care Doctors has 17 convenient neighborhood locations in San Antonio, Bernie, and New Braunfels. For more information, give them a call at 210-731-HTMG. That's 210-731-4864, or visit healthtexas.org.